All right, so still talking about one of these forms that you mostly see in the unit of women in the hospital. We're talking about what is known as a discharge summary form, right? Not really a form; it's written in a form. So, but the discharge summary is actually like is a crucial part of the form, in gynecology, you know. So for this discharge summary, it's just a way of you are trying to like summarize, what the patient came with and at what condition are you actually discharging the patient, right? So this can help you in the next time the patient comes to the hospital, or help the other hospital on the other side that the patient is transferred to, all right, to know the previous conditions that were wrong with the patient and all of that. So this is what you in discharge summary, you are talking about how that patient, what condition the patient was admitted in, then after the discharge, at what condition were they well, all right, what were the treatments and all of that. So it's just a formal medical document. So it's prepared after a patient hospital stay, or maybe there was a surgical procedure that the patient came with, so you guys are about to send the patient back. So it provides concise yet very comprehensive overview of the patient diagnosis, treatment and recovery, and it's essential for continuity of care as the patient is maybe coming back for consultations. You are looking at what the progress. Also legal documentation, of course. You are keeping it as a proof, so that if there's any lawsuits coming up later on, you can show the proof that okay, we gave so care, we discharged the person so date at so condition. Also, it will help you in follow-up planning, right? So what are the key components? What are the different things you see in what a gynecological discharge summary? All right, so you see the name of the patient, the age, all right, could be nation ID number, could be hospital number too. Admission diagnosis. What was the person diagnosed with? All right, maybe at the accident and emergency center. So when the person was brought to the ward after all those tests, laboratory tests, physical examination, medical history, what was the final diagnosis? Procedure performed. Do you guys do any surgery on them? Then also you document all the tests that were done though, right? Operative findings, hospital calls, right? How long did they stay in the hospital? Were they moved from one hospital ward to another and all of that? What were the drugs that was given to the patient? Discharge condition. So the patient was discharged, were they stable? Were they referred? Or were they not stable? All of that. Then it also talk about the vitals as at the time of discharge. Okay. So common post-operative instructions is alright. Okay, this one they're just trying to look at pain management, wound care, activities and all of that.